Hi, Carmen.
Hi.
Would you please share with me your story about your problems and so on?
Well, I had a dental procedure 16 years ago that dislocated the jaw joints, and I've had pain ever since, progressive.
And where was the pain initially?
Initially, it was in just the front of my face here, and then it started encompassing my entire head. And eventually, after 6 years or so, it trickled down to my neck area and then shoulders. And so for the last 10 years, I've basically had just the head, neck, shoulder, intense pain.
And you also had a lot of fatigue.
Yes.
Okay. And you're an RN, but you're unable to tell me about that.
Yes, I just don't feel safe to work because I'm so distracted by the headache and don't feel like after a few hours that I can even think clearly. I don't feel safe in the workplace.
So you decided not to?
I haven't worked at all for 3 years. And
because of that?
Right.
Okay. Prior to that, I mean...
Prior to that, I had reduced to part-time. I had taken off a couple of years at a time and then thought, oh, I need to go back to work, and I would go part-time for a while and then I
finally couldn't do it.
Yeah.
Okay. All right. So tell me about the treatment terms you have had over the last 16 years.
Okay, well, initially I couldn't get diagnosed. I just knew I had a headache. They whittled on the crown that had caused the original
So it was
trauma,
really one crown that kind of started all of this?
Right.
Where was that at? In the mouth?
On my upper left.
Just a single crown?
Right.
Okay.
And anyway, I realized after the fact that, a long time after the fact, that I believe that the bite trays that were put in my mouth to take impressions may have, shoved the disc out. But at any rate, I went to, internist, probably a couple internists, a rheumatologist, oral surgeon. I was working in the hospital at the time, so I had a neurologist that I knew, take a look at me in the hospital, and I didn't have an appointment, but couldn't get any concrete diagnosis. And
what were some of the diagnoses they thought of?
One of the internists said that I was depressed, and that's why I had the headache, so he put me on Prozac.
Did that help?
No, it did
Okay.
not. What else? The oral surgeon I went to did a panoramic, and based on that, he said that I did not have any joint problem, no TMJ problem. I believe he said because there was adequate space, and so that would rule that out.
Based on that panoramic x-ray?
Yeah.
Got it. Okay.
And he prescribed multiple times, like a Medrol dose pack for me, because that took the pain down a lot. I mean, I actually felt like I could live when I was taking those steroids, and then when I would be off of them for a while, it'd just be right back.
Okay. This was about what year would it be, approximately?
This was probably 1998.
Okay. All right.
And well, the rheumatologist really didn't come up with anything other than she said I had, scoliosis and kyphosis and lordosis and
All spinal problems?
yeah,
Okay.
and ligamentous laxatus.
Loose ligaments?
Yes. So that's what but she really couldn't, link any of this to the headache to any of that. So
Okay.
basically I didn't have anything there either. And eventually the dentist who did the crown referred me to Dr. Hayden, Jack Hayden.
Yeah.
So I went to see him for many, many years. And
About how many years would that be?
probably from 1999 on through. He retired maybe in 2006 or 7.
That's 6, 7 years.
And he did conservative things, he did experimental things, Prolotherapy, trigger point injections, splint on my upper teeth actually.
Okay.
And I wore that splint the whole time that I was with him.
Okay.
And then nothing was successful, so I elected to have surgery. So I went to Dallas area, and Dr. Dean White did.
Is that a surgeon that Dr. Hayden referred you to?
Yes.
Okay.
And he had specialized in this kind of joint surgery. So I had arthroscopic on both sides, and right after surgery, my pain was gone. So I was very excited, and then a couple of days later, it was back as bad as it had ever been.
Okay.
So
And you're attributing that 2-day relief to?
He put me on a new prescription anti-inflammatory, and also, high dose of it, and also I don't know this for sure because I've never read the surgical report, but I feel like he may have injected Marcaine.
Long-acting anesthetic?
Yeah,
Okay.
at the time of surgery.
Okay.
But at any rate, it wasn't successful. I did a lot of physical therapy, physical jaw therapy after that, which I knew I was going to have to do. But
You've also tried acupuncture, if I remember correctly.
yes, early on when it first happened, I did with no relief, and then maybe 4 years ago or so, I tried another Dr. Chaudhry here in the area or in Raytown, and no relief. Although I felt like he really had
He's an
skill
expert
in
at
that
it.
area. Yes, and I've known other people who've gone to him for other things who've gotten 100% relief. But just for my particular case, it wasn't effective.
Okay. And then?
Let's see, then Dr. Hayden actually referred when he retired, he referred all of his jaw patients to Dr. Larry Pribble. And so, well, I'm going to backtrack. I did go to UMKC School of Dentistry 7 or 8 years ago. After not going anywhere for a couple of years, and then the pain was so bad I thought I couldn't live another minute. So I went to their faculty practice area where they had a TMJ specialty, and just didn't have any good results. I didn't have a good feeling about their competence there.
You said
so
you said they did a CT scan,
they did a CT scan. They
put you on medication, Medrol.
yes, that I had been on prior. I mean, I just needed a new prescription for. And then really it was a blessing that the man who was treating me ended up getting sick and having to take time off. And so I just kind of reevaluated, because I just didn't feel like I was going to get any results there. I just didn't feel like they had the skills or the competence to do what
So you called it a blessing just because he's no longer treating you?
Yes.
Okay.
But he did eventually come back, to the practice. But by that time, I thought, I just felt like I was wasting my time.
Okay.
So then again, I just laid back and didn't do anything for several years. Eventually, I went to Larry Pribble, who Dr. Hayden had referred his patients to when he had closed his practice and retired. And I didn't have a good experience.
How many years were you under? How long were you in treatment with doctor?
Just a little over a year, from
Okay.
January of 2011 to like March of 2012.
Okay. How much relief did you have?
I didn't have any relief of the pain.
Okay. Okay. And then that's about the time you found us?
Yes, I then called Dr. Hayden at his home and asked him, did he have anybody else that he could recommend, and he recommended Dr. Rahman.
Okay. So tell me about when you first came, I asked you about your main concerns. What were those?
I just wanted pain relief.
What were the pain
of any
areas?
kind. My entire head, my neck was the hot spot. It has been for a couple of years. The back of my neck was just so intense. At times I would just have to go to bed because I could not take the pain, and I was on I've been taking anti-inflammatories for this pain for 16 years. And even with those, even I would double up at times.
What were you on? What
medication?
Aleve?
Oh, Aleve and
Naproxen.
diflucan. Is that the right one?
Okay.
Or is it diflunisol? I think it's diflunisal.
Okay.
Is the prescription one, yeah.
Okay.
Scratch the diflucan, that has nothing to do with this. Oh, I couldn't even, I've been on many different anti-inflammatories, and I can't, Mobic, I've been on Mobic. I was on, well, I can't think of the one that has a sulfa property to it, and I was allergic to that, but it's one of the newer ones that came out when Mobic did.
Everything they had under the sun.
I've been on many anti-inflammatories,
Okay.
yes.
All right. So then we did an evaluation to see if I can help you, and then we did some testing.
Mm-hmm.
So briefly describe what has happened since.
Okay, well, through the EMG testing, Dr. Rahman
Would just be me. I'm right here.
pinpoint, yes, the most relaxed position of my jaw and my bite.
Mhm.
And so he's created an overlay orthotic on the bottom teeth that brings my bite into that position. And that was done a little over 3 months ago. And it took about a month, but then my pain started decreasing.
Mhm.
And I had difficulty at first getting into the new position because I was so used to being way back, my bottom jaw being way back.
Mhm.
So some elastics were used, some rubber bands to gently bring me into the new position, which is home now. It's where it's
Took a little
just natural.
few weeks.
Right.
Okay.
And so after a month, I started, having pain relief, and it kind of depends on the day and what I've been doing, and I'm also going to physical therapy.
Sure. And you had physical therapy in the past also. You mentioned earlier.
Just for the jaw joint when
Okay.
I had that surgery, yeah.
Got it.
So, sometimes the physical therapy, I think, is contributing to the pain because I'm just using muscles that have needed to be used for a long time that haven't been being used. But ultimately, my pain is 30 to 50% better. Just
And you mentioned
depends on
about
the day.
there are days you don't take anti-inflammatories.
Right, I probably haven't taken an anti-inflammatory for maybe 5 days now.
In the past, you would take it.
Oh, had to take it every day. If I was out of it, if I ran out of the prescription or didn't have a leave at the time, I mean.
There'll be a crisis?
The pain, yes, the pain was so bad. And I will say this, when I went to Dr. Lawston, who was the UMKC guy, I asked him, do you have anything new that's come about? Can you replace the bottom jaw? Can you replace the joint? Isn't there some prosthetic that you can do? He said, well, there is, and we have done that, but he said that, the success, it turns out to be more trouble sometimes than they were in before. And he said it just hasn't proved effective, and the only reason we do that is if somebody is suicidal. If there's no other, like they're gonna end their life because they can't take the pain anymore. And after that, many times I thought, man, because I've been that way. I've been suicidal, thinking, gosh, I just can't live one more day like this. And so to have 30 to 50% reduction in the pain is something that I never thought was possible.
In about 90 days.
Right.
Well, good. I think he was referring to artificial jaw joint.
Yes.
Yeah, they have a really poor success rate. Actually, not much of a rate at all, but yeah, he's right in that. So what would you tell perhaps somebody that had some of your symptoms, for example, you couldn't even continue your work as a nurse and so on, people that are struggling with that, it'll be kind of sometimes hard to see a way out of that. There's any words that you could share with somebody like that?
Just don't give up. I mean, it just takes getting to the right person. And, there are many years that I did give up, and without my husband encouraging me to keep moving forward and try different options, I probably wouldn't have come to Dr. Rahman. So just don't give up, because eventually you're going to get to the right person and be helped.
Okay. Well, thank you. We're going to now do the second phase after this. So at this
Right.
point, the first phase, and now you chose the second phase, which is the neuromuscular orthodontics. And but I just wanted to get the update where we are in 30 to 90 days.
And I want to say before we end that I've
Uh-huh.
actually gained a couple of pounds. I haven't been able to gain weight for years, and I've actually gained a couple of pounds, and I just know it's because I'm in less pain.
And you're able to eat better and so on.
Right.
Awesome. You look a whole lot better too.
Oh.
Thank you.